autoimmune condition that affects the thyroid gland and actually can cause hyperthyroidism, or in other words, an overactive thyroid. While traditional medicine often relies on medication or removal of the thyroid with surgery to manage the symptoms, I prefer to take a little bit different of an approach, and it offers a much more comprehensive and individualized approach to care. So, what is Graves' disease? Graves' disease is a condition in which the body's immune system attacks the thyroid gland. This causes it to produce too much thyroid hormone and can result in symptoms like heart racing out of your chest, weight loss, sweating, anxiety, all of that. So, Megan, tell me more about this unconventional approach. I and practitioners like myself that practice more of a functional integrative medicine approach take a patient-centered approach to this care. And I really like to focus on what is the underlying root cause of this condition. So I consider a wide range of factors like chronic stress, our sex hormone imbalances, what things we're exposed to in our environment, toxins, all of that stuff, also gut imbalances, and then nutrient deficiencies, which those nutrient deficiencies can be caused by the gut imbalance. And then, and so you really got to get back and start addressing these root causes. So I help improve that thyroid function to reduce symptoms in so many people with Graves' disease. All right, what are our treatment strategies? Because I'm just told that I'm just going to have to take this medicine until I decide to have my thyroid removed. Tell me more. This approach involves a combination of lifestyle changes, supplementation, and medication as needed. Some of the strategies that are used to manage Graves' disease include diet and nutrition and finding out which nutrients you are deficient in specifically and focusing there, managing stress. I know we can't sell our kids and our husbands and, just delegate everything in our lives, but having good coping mechanisms when we are dealing with everyday stressors is very important. Then balancing our sex hormones is hugely important with managing conditions of the thyroid. Detoxifying the body. One gal I have worked with, we found out that she had been exposed to so much arsenic, and just detoxing that and getting that out of her system, removing the source, made a world of difference in her life. Then we also have to support the gut and really get the motility and get things all figured out in the gut microbiome. And then yes, we supplement with key nutrients. So to wrap things up, Graves' disease can be so challenging to manage, and it can be so frustrating on the individual's part because you're dealing with it day in, day out. Practitioners, we only see you every so often, and so we don't get the gravity of what you're experiencing, but I do get it. I'm there with my people. I want to help them. And this unconventional approach offers this comprehensive, individualized approach to your care. By addressing these underlying root causes and treating you as a whole person, functional integrative practitioners and myself, we can help you improve that thyroid function and greatly reduce those symptoms that are plaguing you on a day-to-day basis. And if you're struggling with Graves' disease, consider working with a practitioner who is knowledgeable about the whole process and not necessarily just the thyroid, and really develop a personalized treatment plan to not only achieve optimal health, but optimal quality of life. I do have a thorough thyroid blueprint at checkthyroid.com if you're interested in a very comprehensive approach to treating your Graves' disease.